everybody, I'm Dr. Michael Nusbaum.
And I'm Dr. Daria Klachko, Totten.
And welcome to
HealthTalks.
So today we're going to actually talk about...
We're going to talk about the different types of fat we can gain.
Okay. So visceral fat versus subcutaneous fat?
Exactly.
Okay. One of my favorite topics.
Yes. The weight loss expert here.
Exactly. Well, it's funny you ask that question because I do a lot of liposuction also, and it kind of fits into the weight loss because you lose the weight, but you still have that mommy pouch or something that's going on.
A little extra that you want to get rid of.
Exactly.
Right?
I've had patients get down to their ideal body weight and they still have that little pouch.
Yeah.
That is actually subcutaneous fat. That's not visceral fat.
So subcutaneous fat is like the fat that we can see, like the roll and, what kind of, takes up some of...
Probably pinch it. When you're pinching an inch, you're
Okay,
pinching
I like that.
the subcutaneous fat.
Yeah.
The visceral fat, the bad fat, that's the fat associated with heart disease, the fat that surrounds your heart, your lungs, your organs, for anatomy purposes, the omentum, that's a drape, a blanket of fat that hangs down from your transverse colon. That is the visceral fat.
And that's the dangerous fat.
It is. The fat surrounding your organs. And if anybody has been told they have a fatty liver, that's visceral fat.
Right.
All right. So once again, that increases your risk of heart disease.
And diabetes.
Correct. You can't suck out visceral fat.
Right.
Unfortunately, there's no way to do that, and that's not something I think that's ever going to come up with. But you need to do a diet to get rid of the visceral fat.
That's right.
Subcutaneous fat, completely different, but you will lose both visceral fat and subcutaneous fat when you do a weight loss program.
Right.
And that's that kind of change in your body when you start to see, your waist changing and your dress size goes down, your waist size goes down, pant size goes down. You're starting to fit into clothing you couldn't fit into.
And by losing that weight, not only are you maybe feeling better about the way you appear, but you're also improving your health.
Absolutely.
And you're reducing your risk substantially for cardiovascular disease, diabetes, certain cancers. So it's really, really important, I think, for people to lose both types of fat, the visceral and the subcutaneous.
And when you're doing a diet, that's exactly what is going to be happening because you're losing fat that your body has as excess fat, which is both visceral and subcutaneous.
And talk to us about how, I remember when I went through the weight loss program here, I stood on one of those
the embodying?
Yes,
so
the
your body composition machine.
And it was bad. Mine was bad.
So those are very important when you're doing a weight loss program to actually see how your body is changing. They're not all the same, and there's different levels of even that in-body machine. There's some that you can get in a gym, and there's higher grade ones for medical professionals and weight loss centers like ours, which really drill down specifically as to the difference between visceral and subcutaneous fat and where it's located in your body.
And I think that was super cool for me because, of course, I wasn't feeling great because I had gained, quite a bit of weight. But to hear that my visceral fat was, not in a good place was really kind of like alarming to me. I'm like, not only am I not feeling good about how I'm appearing, but it's not healthy.
Right. And I think that is a wake-up call for many patients when I talk to them about that. And I say, look, this isn't just about you looking good and feeling good. This is about getting you healthy.
Right.
And I think, look, most people, it resonates with those people.
Right.
I think most people who come in for a weight loss program do want to get healthy. It's not just about looking good, which is definitely a benefit of it.
Right.
But if you're overweight, you're at risk for heart disease, high blood pressure, diabetes, sleep apnea. All these kind of take their toll on your body. So, getting the weight off is going to extend longevity.
Yep.
You will definitely live longer. You'll have less disease, and you'll feel a lot better.
Right.
So, once again, I do recommend that when you're looking to lose weight, I want you to focus on getting healthy, not just looking good.
Yeah.
And the visceral fat will come off, the subcutaneous fat will come off, but you will probably still have some areas, even after you get down to what you're happy with, in the subcutaneous fat that's not going to go away. There are some resistant areas.
Right.
Another one is arms. A lot of the bat wings. A lot of patients like to say, and their treatment. So we do a smart lipo on that. We're using a laser that can tighten the skin up really well. I mean, it's all.
Glad that there's all these options, out there and available. So, and I think the point is to be able to live healthier and happier and live well.
Absolutely.
And learning how to, take in food as nutrition so that you enable your body with the best fuel for the future.
Right. So once again, visceral fat is the bad fat, the fat that's internal surrounding your organs. The subcutaneous fat is the fat you can actually pinch and may not completely go away even when you hit your ideal body weight. So I wish you guys the best in your weight loss journey. If you lose weight, you're going to lose both visceral fat and subcutaneous fat.
And live healthier and longer.
Exactly. As always, if you have any questions, please reach out. I'm Dr. Michael Nusbaum.
Dr. Daria Klachko Totten.
And thanks for joining us
Health
at HealthTalks.
Bye.
Bye.